Hello. Hello, Joyce. This is Helen from
Welcome,
the Joint
Helen.
State Government Commission.
Thanks for joining.
Hi, it's Lizette from Mercer County.
Thanks, Lizette. Thanks for getting on. Anybody else?
Linda Drummond.
Hey, Linda.
Hello there.
Cindy Daly.
Hi there. This is Jen Malone from Lawrence County Community Action.
Great. Welcome. Hey, Cindy.
This is Lauren Campbell from Decade to Doorways in Chester County.
Thank you.
Hi, this is Emma Hertz from Your Way Home, Montgomery County.
Welcome, Emma.
Mary Candrake Lenser, Center for Rural Pennsylvania.
Thank you.
Ashley Mancini, Regional Housing Coordinator.
Thanks. Well, welcome, everyone. This is Joyce Sacco with the Housing Alliance of Pennsylvania. We're waiting for my co-chair on this is Joe Willard. He's the Vice President for Policy at the People's Emergency Center. We have this meeting once a month with providers across the state who work on ending and preventing homelessness. And we have a good lineup today of folks who are going to educate us on a bunch of different things. We sort of reworked the agenda a little bit. We're going to start out today with Patrick Keenan. He's the policy director with the Pennsylvania Health Access Network. They've worked closely, or we've worked closely with them on Medicaid, using Medicaid dollars for supportive housing services. So we're continuing to work on that, the campaign. It's not a done deal yet, but we'll continue to work on that with him. And he's here today to give us an update on Medicaid and the ACA and sort of some of the talk that's been happening down there. So it's my pleasure to introduce Pat Keenan. Yes.
Joyce, this is Howard Ehrman with SPHC also.
Welcome, Howard. Thank you. And we're going to leave the lines unmuted right now, but if you're not speaking, if you want to mute yourself by doing *6, that would be great. Thanks, everyone, and I'm going to pass it off to Patrick.
Great. Good afternoon, Joyce. Thank you for having us on the HAPPN call. I was heartened to hear a lot of folks that have worked with us on the Housing is Health campaign, so it's good to hear familiar voices again. We thank the Housing Alliance always for their leadership within the housing provider community, because it's really crucial that folks are connected to what's happening here in D.C. We're actually, as a change of pace, we're down here in D.C. with other national advocates at the Families USA conference, and we're talking a lot about proposed changes to healthcare in Pennsylvania, and specifically what could really be seen as a radical restructuring of Medicaid, a departure from a 50-year partnership that Medicaid has enjoyed with the federal government. And it's really concerning, because I think that when we have been talking with folks all across Pennsylvania, they hear about the Affordable Care Act, and they think about folks that, newly gained coverage under the law. So folks buying private insurance on the marketplace or benefiting from Medicaid expansion. And many of the populations that housing service providers are encountering are traditionally eligible for Medicaid, either because of disability or some other age or some other traditional Medicaid category. And the key thing that we are at BAN and with the Insure PA coalition behind us, which is right now about 70 organizations, fighting to protect the Affordable Care Act and Medicaid, Medicare, and CHIP in Pennsylvania. What we know congressional leadership is thinking about is a radical restructuring that would not just limit the expansion of Medicaid under the ACA, but really decimate traditional Medicaid. Two programs that have been, and to give a little bit of context here, what does that mean? Medicaid in Pennsylvania covers 2.8 million, or 1 in 5 Pennsylvanians. Almost half of those are children. Medicare covers another 2.5 million folks. So significant portions of Pennsylvania's populations are affected by Medicaid. And a large percentage of those folks are due to, disability, age, whether they're children or seniors. And so all of those populations are really going to be affected if some of these proposals for restructuring Medicaid go through. The two proposals that are out there are block grants and per capita caps, and we, in the interest of time, we've got an hour-long webinar on block grants we're happy to share with folks if they want to know more. But, block grants and per capita caps are really a way for the federal government to step away from its funding commitment to Pennsylvania. Why do they want to do that? One of the big things on the agenda, in D.C. right now, besides the Affordable Care Act, is tax reform and lowering taxes. And, the only way that they can do that is if they strip away the entitlement provisions for Medicaid. What does that mean? It means that, folks right now, if you're eligible based on your category and income and you go through the screening process, you are entitled under federal law to be able to receive Medicaid with its robust benefits package. Block grants and per capita caps are two ways that they actually remove the entitlement from Medicaid, meaning that the states would be able to choose. They would have a fixed amount of money to provide coverage to beneficiaries, and that fixed amount would not grow over time. It would grow by a very small amount, but it certainly wouldn't keep pace with healthcare spending and with the aging population as baby boomers, enter into nursing homes or require higher levels of care. And so the states would be forced to pursue under either block grants or per capita caps. There's no one situation that's better than the other. They're both bad for Medicaid. And they both mean that the states, since it would have less funding to provide Medicaid to folks in Pennsylvania, would have to choose to either cover or not cover certain groups, to set enrollment caps on Medicaid or create waiting lists, to create higher income standards, or lower income standards so that fewer people would qualify, to impose work requirements, on folks receiving Medicaid. Certainly one of the biggest tools that they would seek to go after is not covering all the benefits that are currently required by federal law. States would also seek to reduce the benefit scope or set time limits on the benefits that Medicaid beneficiaries can receive. And they would also seek to push more costs onto the Medicaid enrollees, whether it's in the form of premiums or higher copays. And then, the troubling thing for many of us is that if folks, can't afford because of their limited income, those copays or those premiums, they could be disenrolled or locked out from their health care coverage, especially at a time when they most need it. Our key concern right now is that, everyone in the human services community needs to know that block grants and per capita caps are being talked about and discussed in D.C. They need to know that neither one is preferable. Some are starting to say that, there might be a better way to do this with per capita caps, and that's simply not true. Both of them, block grants or per capita caps, are a way to, leave the state of Pennsylvania paying more and more money for Medicaid while backing away from the federal commitment, and also stripping away the entitlement criteria to Medicaid, which could be very devastating to many of the clients that you serve. And so I'm out here today to introduce those two concepts and to let folks know that there is a group that's advocating to make sure that this doesn't happen in Pennsylvania. Some of you have already signed up for this campaign, but if you go to Insure PA, INSUREPA.org, there's more information there, and you can either, as an individual, sign on to the campaign and get our weekly updates on what's happening here in D.C. and what kind of actions need to happen. And, also more importantly, if you're able to do so on behalf of your organization, we'd like to grow that number from 70, organizations to many more, to show that that Medicaid is a program that works here in Pennsylvania. Its current structure is benefiting, low-income individuals, persons with disabilities, children, and everyone in between, and we want to keep and protect that structure. So I know that, and also there's the educational events that we have that will kind of dig in deeper into these things and educate folks more about what block grants and per capita caps could mean. So with that, I'll be brief. And Joyce, do we have some time for questions? Or
we do. If people have muted themselves, to unmute, do *7. So if anyone has a comment or question for Patrick. I did want to also add, separate from that, the Housing Alliance, Patrick, and the Department of Human Services are continuing, and I feel like we're making progress on the discussion around Medicaid and supportive housing services. So that's still, for other folks who've been on this call in the past, we are still moving ahead with that, sort of in tandem with this work that Patrick and Insure PA is doing around Medicaid. So thanks. Are there questions? Comments? Anybody? We will send out the website, Patrick, to folks who are on the call, and maybe your contact information, if that's okay.
That's fantastic. And just to, just to put a little bit of sense of urgency behind some of these things, what we're hearing, because things have kind of stalled a little bit around the Affordable Care Act, we don't want anyone to think that, it's a comfortable situation right now. Current reports from our national partners and folks, familiar with the actions of Congress are indicating that March is going to be a very important month for this. And so we really need to mobilize our grassroots community and as well as the other organizations that serve that community around showing the effectiveness of Medicaid. So please follow up with that website, if you're interested, and we would be happy to, if any of you are connected with other groups, we would be happy to talk about block grants or per capita caps in more detail and what they would really mean for the populations you serve. So thank you to Joyce. Thank you to Joe for letting me go first, and I really appreciate everyone's time today.
Thank you, Patrick. I'm going to pass it off to Joe Willard.
Hi, yeah, thanks, Joyce, thanks. I'm going to introduce Joe Savage. Many folks on the call know Joe, but many do not. So Joe is a regional coordinator for the Mid-Atlantic region for the U.S. Interagency Council on Homelessness. Prior to that, Joe worked for a long time in Philadelphia, working for the Office of Homeless Services, managing a variety of programs, including permanent supportive housing, and he was usually the go-to guy when you really wanted to get some things done and all. So Joe has been with USICH for a little over more than a year now and gets to travel up and down the East Coast and all. So Joe, I'd like to bring you on if you could give us an update on what's happening with the USICH and what we should be thinking about going forward.
And also, you're going to talk to us about the criteria and benchmarks for ending family and youth homelessness, correct?
Yes, I am.
Great. Thanks.
Well, thanks, Joe and Joyce. Thanks for having me on the call this afternoon. I always appreciate the opportunity to join you all for your monthly calls. Good afternoon, everyone. As introduced, I'm a regional coordinator with USICH, and I'm actually based here in Philadelphia. What I primarily want to get to today, and I'll save some other things for later, are the criteria and benchmarks that were recently released for ending family and youth homelessness. As many of you may know, in terms of subpopulations, the Federal Strategic Plan, Opening Doors, has three primary goals: ending veterans homelessness by 2015, ending chronic homelessness by 2017, and ending family and youth homelessness by 2020. And in order to do that, we've released a series of criteria and benchmarks by which communities can use to assess their progress to determine if they've reached the goal of effectively ending homelessness for one of those subpopulations. So we released the criteria and benchmarks for veterans homelessness, and we released a revision in October of 2015, and then recently another slight revision in February of this year. In June of 2016, we released the criteria and benchmarks for ending chronic homelessness. And then in January of this year, we released the criteria and benchmarks for ending families and youth homelessness. And so all 4 sets of those criteria and benchmarks have been released for those subpopulations. And one of the things that I want to emphasize before I get into, I'm going to call them the CBM, before I get into the CBM for family and youth, is that these criteria and benchmarks aren't etched in stone. They do tend to get revised as we learn more, as we hear more from communities. The CBM for veterans is a perfect example of that, and I'll get into some more of that when I speak specifically about the CBM for families and youth. But my main point is that by setting these criteria and benchmarks, it's really giving communities a standard by which they can measure their progress, and it's really pushing and driving forth the work in homelessness. As we've seen with veterans, overall veterans homelessness is down by 47%, and unsheltered veterans homelessness is down by 56%. So when we use these criteria and benchmarks to really set aggressive goals, we're really seeing that they work. So relating specifically to the CBM for families and youth, what we used as a template was what we learned from veterans in terms of the CBM for veterans and what worked and what didn't work. And then we also got input from communities as well as national organizations. And again, that input is ongoing. So what I'm going to review today, we are going to be releasing a series of webinars as well as FAQ documents, as well as some other supporting materials for the criteria and benchmarks. So look for that to come. If you want to access the criteria and benchmarks for families and youth, you can certainly go to the USICH website at www.usich.gov. But what I'm going to review today is just going to be a high-level overview of the CBM for both of these subpopulations. Each of these can take an hour in and of themselves. But as I mentioned, we will be having some webinars, releasing some FAQs, and also some other supporting documents. So I'm going to start with the criteria and benchmarks for families. And if you're familiar with the criteria and benchmarks that were established for veterans, you'll see that a lot of this language is similar. And the first thing that I want folks to understand is that when we talk about the criteria and benchmarks, the criteria really look at a community system to see if they have certain elements in place that are considered best practices for ending homelessness. And then the benchmarks are a series of data points that if what's described in the criteria pertaining to that community system is indeed true, then the data points in the benchmarks will prove that. So the criteria and benchmarks work together. And then also when we're talking about ending family and youth homelessness, we're using the same language that we're using for veterans, is that we're talking about effectively ending homelessness. This does not mean that you will never ever see a homeless family or youth in your system, but what it means is that if that homelessness cannot be prevented, that the community will have the system in place such that it will be rare, brief, and non-reoccurring. And we often encourage communities to really get out ahead of this message with the media, particularly so because what we've seen with veterans is that as soon as a community makes an announcement that they've been confirmed for achieving the goal of effectively ending veterans homelessness, the media will go out, find the homeless veteran on the street, and then publish a story about the community making a false claim. So we really encourage communities to start to get this messaging out early in terms of what we mean by effectively ending homelessness. So the CBM for families. There are 1, 2, 3, 4, 5 criteria, and then I'll talk about the benchmark after I get to the criteria. So criteria number 1 for family homelessness is that the community identifies all families experiencing homelessness. And then within that, there are 2 specifications. The first, the community literally identifies every family who was unsheltered, in shelter, or in transitional housing settings or other residential programs for families experiencing homelessness, and the community coordinates a comprehensive set of strategies across schools, the child welfare system, hotlines, and 211, and other community-based programs to identify families who are doubled up and identified as homeless under the Department of Education's definition. So this first criteria is really about the community using multiple data sources, multiple means of outreach, as well as in-reach and other methods to identify all families that are experiencing homelessness. And the definition of homelessness is not limited to just HUD's definition, but it includes HUD's definition as well as the Department of Education's definition. And then this is also accounting for families who are doubled up. So that's criteria number one. The community identifies all families experiencing homelessness. Criteria number two.
Excuse me, Joe. This is Joe. Joe,
sure.
Do you want to take questions or comments in between, or do you want to wait till the end?
Yeah, let's wait till the end. If we take them in between, I may not get through them all.
Oh, we got 4 hours to do this, right? Just kidding. Okay, I'm sorry.
All right,
go ahead, Joe. Continue then. Yep.
Number two, the community uses prevention and diversion strategies whenever possible and otherwise provides immediate access to low-barrier shelter to any family experiencing homelessness who wants and needs it. This criteria primarily relates to low-barrier shelter. And what we're meaning by low-barrier shelter is that, first and foremost, it's any form of shelter, whether it's emergency shelter, bridge, or transitional housing, or some other temporary setting, to any family experiencing unsheltered homelessness or an otherwise unsafe situation, including fleeing domestic violence or trafficking, who needs such assistance, and that it's not contingent on sobriety, minimum income requirements, criminal history, or other unnecessary conditions. And then another part of this criteria is that the community does not turn away any family. And then secondly, that regardless of the family structure, they are not required to separate from one another. Yes.
Joe, can I interrupt for just a sec? There's a little bit of background noise. If people can mute their phones, if not, I'm going to have to mute. So again, please. Yeah, I'm going to have to mute the lines. Hold on just a sec. Joe, to come back.
Okay.
I'm muting all. Just do star 7.
The conference has been muted.
Again, Joe, do star 7 to come back.
Can you hear me?
I can. Perfect. Go ahead.
Okay,
Thanks.
great.
Sorry about that.
Yep. So as I was stating, criteria number 2 is about access to low-barrier shelter, and that's immediate access for families to some form of low-barrier shelter that's not contingent upon any type of sobriety, income, criminal history, or other unnecessary conditions. And then additionally, that family members, regardless of family structure, are not required to separate from one another in order to access shelter. So this is similar to the veterans criteria, criteria number 2, which is about immediate access to low-barrier shelter. And again, you can access these criteria and benchmarks from our website, so don't necessarily worry about writing down what I'm stating verbatim. Criteria number 3, the community uses coordinated entry processes to effectively link families experiencing homelessness to housing and service solutions that are tailored to the needs of all family members. This is about the community having a coordinated entry system that is really prioritizing the most vulnerable families, and then all families are being connected to the most appropriate housing options as well as services. That's criteria number 3, which is around coordinated entry. Criteria number 4, the community assists families to move swiftly into permanent housing or non-time-limited housing options with appropriate services and supports. So this criteria is about the pace at which a community system is able to get a family out of homelessness and into a permanent or non-time limited housing option. And when I get to the benchmark, I'll talk about what we are defining as quick. Criteria number 5, the community has resources, plans, and system capacity in place to continue to prevent and quickly end future experiences of homelessness among families. This particular criteria is really around prevention and the community having the proper resources to prevent homelessness amongst families, and understand, even with the previous criteria, the difference between prevention and diversion. If we use the analogy of the front door, with prevention, families don't even come to the front door. With diversion, they're at the front door, but they don't enter the front door. So this is about having the resources, plans, and system capacity in place to prevent homelessness. And so those are the criteria for families. We have identifying all families experiencing homelessness, not limited to the HUD definition of homelessness, but also includes the Department of Education's definition. Number 2, which is immediate access to low barrier shelter. Number 3, the use of coordinated entry to prioritize and make appropriate referrals. Number 4, the system to swiftly move families into a permanent or non-time limited housing option. And then number 5, the resources and system capacity to prevent and quickly end future experiences of homelessness. So those are the criteria. And again, those talk about the system in the community. When we get to the benchmarks, again, these are the data points that if that system is in place, it will show in the data. So for the benchmarks for families, there are 2 benchmarks, benchmark A and benchmark B. And I'll start with benchmark A. There are few families experiencing homelessness at any given time. Now, we are currently still in the process of defining an appropriate number that could be the maximum number of homeless families that the community may have in order to meet this benchmark. So that is something that is going to come out in a future update to the criteria and benchmarks for families. It may be released via a webinar or an updated document. But as of right now, benchmark A is there are few families experiencing homelessness at any given time. And I just want to read the 4 caveats under benchmark A. The community census of families experiencing homelessness includes all families identified by local education agencies or other agencies that meet any federal definition of homelessness, including persons residing in domestic violence shelters or temporary housing for victims of domestic violence. Number 2, no families with children under 18 are experiencing unsheltered homelessness. Number 3, no families seeking emergency shelter are turned away unless they can be successfully diverted to another safe, temporary living environment of their choosing. Number 4, all families identified as experiencing homelessness, including those who are sheltered in emergency shelter or transitional housing, or those who are doubled up, are offered connections to appropriate housing or services. Again, we are in the process of developing an indicator that will express the maximum number of families who may be identified as experiencing homelessness in the community at any point in time. And then we're also considering how to incorporate expectations regarding families who are doubled up and identified as experiencing homelessness within this benchmark. So those are 2 of the nuances that we are still in the process of developing and working out to be released later. So that's benchmark A. There are few families experiencing homelessness at any given time. Benchmark B, families experiencing homelessness are swiftly connected to permanent or non-time limited housing options. This is in relation to the criteria I mentioned earlier and what we have set as that standard. Families with children exit homelessness to permanent housing within an average of 45 days from the point of identification and no longer than 120 days. And if you get a copy of the actual CBMs for this, we have proposed in parentheses. This is the time frame that we are proposing. So it may change based on additional feedback and input that we get from communities as well as national partners. So that's access to exiting homelessness to a permanent housing option within an average of 45 days from the point of identification and no longer than 120 days. As with the veterans criteria and benchmarks, there are two exceptions to this. Families who are offered permanent housing opportunities but decline and instead choose connections to time-limited, safe and stable housing before exiting to permanent housing, including families fleeing domestic violence or with a head of household in recovery, are exempted from the calculation of performance against this benchmark. And then B, it is expected that all families that have chosen to enter temporary housing begin to receive assistance to access permanent housing as soon as they express a desire to do so, with an initial offer of assistance to occur within 10 days of entry into safe and stable housing. And basically what this is getting at, if a family does choose to go into another housing option and they decline the permanent housing offer, this is just to make sure that it is still being offered and that the family understands at the minute they choose that they want to exit that temporary housing option and go into a permanent housing option, they have the choice to do so. So that's the criteria and benchmarks for family homelessness. Joe, why don't we take some questions on this before I do the CBM for youth?
That sounds great and all. Joe, can you hear me?
Yeah, we can hear you, Joe. Also, folks want to ask or have comments, questions, do *7.
Mm-hmm. Right, and when you do, if you could just announce who you are and where you're from, that'd be great. Anybody? Joe, I'll just throw out the very first one that. Hi, who's this?
Hi, my name is April Steele from One Day at a Time, Philadelphia, PA. And so my question is, all the information I just received, can I also find that on the email that he had gave us, the URL, www.usich.gov?
Yes. If you go to the website you just mentioned, www.usich.gov, there are a number of ways you can get it. If you click on the header that says goals, you can click on the goal for family homelessness and pull it up that way, or you can use the search engine and just type in benchmarks for family homelessness and it'll pull it up. But it's accessible at the website, yes.
And I can also get information for ending veteran and for chronic homelessness as well?
Yes, all of those will be there as well, yep.
Okay, thank you.
So, Joe, the very first one about the community identifies all families experiencing homelessness, it's really calling on the local COCs really to have relationships with the child welfare system, the education system, etc. I really like this criteria, and obviously, you know, it's going to take a lot of work to get those systems to cooperate with one another. Is USICH talking about how to help us do that?
Yes, we are in the process of preparing guidance on that. We do know now that one of the huge barriers to really getting this kind of system up to identify families, particularly that are doubled up or in other unsafe housing conditions, is working with the school district in terms of data sharing and FERPA requirements. So we are in the process of developing some guidance on how to really develop these relationships and even guidance on how to set up data sharing agreements.
Anybody else with a question? Yeah. Joe, if not, yeah, go ahead. Why don't you proceed?
Sure. So I'll move on to youth. And when I'm reading these youth criteria and benchmarks, you're going to see that the language is very similar to the family criteria and benchmarks. Again, it goes to the fact that we're using what we saw worked for veterans in terms of the template for criteria and benchmarks, but we have tweaked them for each subpopulation. So the criteria and benchmarks for youth, we have 1, 2, 3, 4, 5 criteria again, and then we have 2 benchmarks. So I'll go through the criteria first, and I'll pick out just the major nuances and then go over the benchmarks. So these are the CBM for youth. Number 1, the first criteria, the community identifies all unaccompanied youth experiencing homelessness. So again, the community is expected to be using multiple data sources, various types of outreach and in-reach efforts. And the first nuance under this criteria, the community literally identifies every unaccompanied youth who is unsheltered, in shelter, or in transitional housing settings or other residential programs for youth experiencing homelessness. And B, the community coordinates a comprehensive set of strategies spanning schools, the child welfare system, including child protective services, the justice system, drop-in centers, hotlines, and 211, and other youth-serving agencies and programs to identify unaccompanied youth who are doubled up or couch surfing and considered homeless under any federal definition. So again, with this criteria identifying all unaccompanied youth experiencing homelessness, it's not limited to just the HUD definition of homelessness, but it's any federal definition, and it does include youth that are doubled up or couch surfing. Criteria number 2, the community uses prevention and diversion strategies whenever possible and otherwise provides immediate access to low-barrier crisis housing and services to any youth who needs and wants it. This is similar to criteria number 2 with families. This is about that immediate access to low-barrier crisis housing, again, not being contingent upon sobriety or other requirements, but that they're able to access some form of immediate housing. That's criteria number 2. Number 3, the community uses coordinated entry processes to effectively link all youth experiencing homelessness to housing and services solutions that are tailored to their needs. Again, this is about having a coordinated entry system for youth that prioritizes them based on vulnerability and connects them to the most appropriate housing and services options. That's criteria number 3. Number 4, the community acts with urgency to swiftly assist youth to move into permanent or non-time limited housing options with appropriate services and supports. So again, this is about being able to quickly get youth into an appropriate permanent or non-time limited housing option with the most appropriate services and supports. Criteria number 5, the community has resources, plans, and system capacity in place to continue to prevent and quickly end future experiences of homelessness among youth. So again, that criteria is about the community having the proper capacity to prevent homelessness amongst youth. So those are the 5 criteria, and as I mentioned, they are very similar to the family criteria, but they have been nuanced specifically for youth. So again, the benchmarks, there are 2 for youth, and again, these are the data points that will serve to prove if the system is indeed in place and operating according to the criteria. Benchmark A, there are few youth experiencing homelessness at any given time. And I'm going to read the nuances under that. The community census of youth experiencing homelessness includes all unaccompanied youth under 25 identified by local education agencies or other agencies that meet any federal definition of homelessness. Number 2, no unaccompanied youth under 18 are experiencing unsheltered homelessness. Number 3, no unaccompanied youth ages 18 to 24 are experiencing unsheltered homelessness, with the rare exception of someone who has been identified and offered low-barrier crisis housing and services, but who has not yet accepted the assistance. But the community is expected to continue to outreach to that particular youth. Number 4, no unaccompanied youth seeking basic center services or emergency shelter are turned away unless they can be successfully diverted to another safe, temporary living environment of their choosing. Number 5, all youth identified as experiencing homelessness, including those who are sheltered or double up, are offered connections to appropriate housing. And again, we are considering an indicator that will express the maximum number of unaccompanied youth ages 18 to 24 who may be identified as experiencing homelessness in a community at any point in time. So again, that will be something, that indicator will be released at a later point. And then the last benchmark for youth experiencing homelessness are swiftly connected to safe and stable housing opportunities and to permanent housing options. We are in the process of developing relevant indicators for this benchmark. What we do have for now for youth under 18, the length of time in shelter before reunification or placement into permanent housing, transitional housing, or other safe and stable housing. And for youth ages 18 to 24, the indicator is going to be framed in the context of the length of time in shelter before placement into permanent housing or transitional housing. But unlike the family, we have not yet set a number on these two categories for how quickly a youth is accessing permanent housing for youth under 18 and for youth ages 18 to 24. So again, these criteria and benchmarks can be accessed at our website, www.usich.gov, and then look out for future announcements for webinars, FAQ documents, and other supporting materials. If you do go to our website, if you sign up for the USICH newsletter, that's how you will be kept abreast of the resources and the webinars that will be released in the future regarding these criteria and benchmarks. So any questions regarding the CBM for youth?
Hello?
Hello, who's this?
Yes.
Hi, my name is Omar Sharif. I'm from the All Out Veteran Support Group. I'm out of Pennsylvania, the Poconos. And I wanted to know, is there going to be a list that developers can sign up to where if you go on the website, you can see what properties are available if someone was in need of housing?
Hi, this is Joe. Joyce,
Joe?
I don't know if Joe Savage from USICH would have that. Do you have information on that, particularly your work with the Northeast RAD?
I think that what we could do is talk offline, Omar. I think that might make sense. Does that work for you?
Yes. Is there a number where I can call?
Yeah, 215-576-7044.
7044. Because presently I'm working on 125 units right now. It's an old motel that I'm renovating. I'm looking at transitional and permanent housing. And, you know, I listen to the seminars, but as a developer, the challenge that we have is always funding, you know. So I was just wondering, would there be a site where it will list the developers? Okay, but I'll give you a call. And your name is?
Joyce.
Joyce, okay.
Yep.
Oh,
Great.
okay, thank you.
Other people?
Yeah, this is Joe Willard, asking for Joe Savage. Joe, do you expect any of this work to show up in the COC application for the next time that comes around?
It's possible. And something that I had meant to mention for both of these, the review process has not yet been worked out. It's under development, and there could potentially be some reporting in terms of the data points in the COC application. But don't take that to the bank. It is possible.
Okay.
Great. Well, thank you so much. Is there anything else?
The only other thing that I'll mention, as many of you may know, USICH does have a sunset date with the federal government, which is set for September 30th of this year. We are in the process of using the appropriations process to extend that sunset date. So as of right now, on the Senate side, it's in the budget to have us fully funded for another 3 years. On the House side, it's in the budget to have us not fully funded but partially funded, but only for a year. And as many of you may know, Congress has not yet passed the budget. We're still operating under a continuing resolution. So we are using the appropriations process to get that extension, but we're still working to get it extended till 2020 in terms of an actual statute. Within USICH, we are meeting with members of Congress individually. There are national organizations and research organizations that are really reaching out to Congress and providing data and reports on the work that USICH is doing. I can't tell you all what to do specifically in terms of advocacy. I can't do that, but I'm pretty sure you all can think of a number of ways in which you all can talk about the importance of the work that USICH has done and the needed work that USICH is doing.
Thank you again, Joe.
That's it.
We can. This is perfect. Thank you. We appreciate your time. And we have also asked Joe Savage to potentially do a webinar in the future on this issue. So thanks again. Up next, I want to introduce Lee Howard, the president of Diana T. Myers and Associates. She's going to talk to us for a bit on the homeless point-in-time count. So, Lee, again, do *7 to unmute yourself. Is that you, Lee?
Did I unmute?
You're good. You're good to go.
Oh, great. Sorry.
That's okay.
The lack of oxygen from what Joe was saying really kicked in right then. It was great to hear Joe sort of do an overview of the benchmarks. I think for those of us who have been focusing on the veterans and the chronic benchmarks, this is a significant leap forward, and a pretty high bar has been set. So more to come on that. Okay, so per Joyce's request to have a quick PIT update, I reached out to a few folks and asked if they were going to be on today's call, if they would feel comfortable just giving a quick overview. In most of the counties where we work, which is primarily the eastern and western PA balance of state COCs, the PIT date was January 25th. We're still getting data in, but I have requested just some quick updates from folks, and I'll be happy to share what we've learned thus far and then open it up if other folks want to talk about their experiences from the PIT night or any sort of preliminary data that's come in. From Center County, we heard that they had a slight increase in their sheltered population. Wayne County had both an increase in sheltered and unsheltered. If you don't know where Wayne is, it's literally the farthest northeast county in the state, and a couple years ago never had reported anybody sheltered or unsheltered, and this year is reporting both. So that's a sort of a big shift there if you look historically. And in the Lehigh Valley, I'm happy to report that they had a slight decrease, at least in the initial reports that we received, about a 5 or 6% decrease from the previous year, which is great. Also heard in terms of folks outside of the balance of state, from Luzerne County, they found during their unsheltered PIT count 5 campsites, didn't find people at each of those campsites, but that was, I believe, an increase for them. And then York County also reported just a reduction in sheltered and unsheltered data. specifically they reported that they had been seeing year over year a rather significant increase in youth homelessness each year, but this year within the context of having some reduction in sheltered and unsheltered. They also indicated that they saw a slight dip in the youth as well. So that was good to hear. So beyond that, I don't have a whole lot more that I can report yet. I'd be happy to share any updates once we have that data available. But if anybody else from other counties are on the line and would like to sort of just give an update on their count, that would be great.
Again, to do that, do *7. And we just thought it was important. It's a big event. It certainly dictates funding into communities, so we wanted to just address it briefly here. Again, does anyone want to comment or have a question for Lee? Do *7.
Hi, this is Dina Sabatoni from Beaver County and the western side of the state. We just have preliminary numbers as well, so nothing completely official to report at this time. Our sheltered count was about the same as last year, so nothing too surprising there. Our unsheltered count, however, was 3 times higher than what it was last year. Yeah, so we're trying to get our heads around that. The most obvious reason for it is we had a more robust outreach campaign this year. We had more outreach teams. We covered more area. We covered more of our rural areas, which are always a special challenge. And we actually found a family of 6 in a more rural area. So last year we had 6 unsheltered folks that we found. This year we had 18. So, you know, bittersweet. If they're out there, we're pleased to find them, but we'll be looking in a little bit more deeply to what we can do to prevent that from happening again.
Thank you for sharing.
Thank you for sharing.
Sure. How do I unmute? *7?
You're good. You could do *6 to mute again, but it's fine.
Okay. Thank you.
Sure. Thank you for
One thing I'm going to be looking to hopefully maybe during a future HAPPN call will be to hear specifically how folks did with their additional sort of outreach for homeless youth. This was the year with which HUD will be setting sort of our baseline for county youth moving forward. And I know that folks were doing a lot of extra planning around counting youth. So I don't know if anybody today or maybe that can be a topic for a future agenda so that we can sort of learn from each other what worked well in various communities.
Sure. Yeah, that sounds like a good idea. Anyone else?
Hi, can you guys hear me? This is Ashley Mancini.
Yes, we can hear you, Ashley.
Hi, Lee. You know, I wanted to ask you about that. I did notice when I was going through my region, a lot of counties were talking about how they try to target the homeless population. Do you see where HUD is going to move forward with these numbers? A big complaint that folks are having is that transition age youth are not meeting the chronic homeless definition and are not fitting into some of these supportive housing programs that they would benefit from. But yet also HUD is, shifting from transitional housing programs, which is another program that transition age youth would benefit from, but we're losing a lot of those. So the big concern is what do we do with these folks moving forward? Do you have any ideas? I know it's a big question. I'm sorry.
It is a big question. I think that a lot of folks are looking to identify what types of interventions are most successful working with youth. I know that in the eastern part of the state, will have awarded from the last funding round a new rapid rehousing specifically for youth program. I do know some of the other counties in our state already have rapid rehousing specifically for youth. I know that you're in the Southwest region, and I know that there is sort of some ongoing conversation about the future of transitional housing there, and specifically about transitional housing that's targeting not only domestic violence but also specifically youth. And sort of continuing to fund that or not, I think is an ongoing conversation, and I think it's a really important question. I think the one thing I will just quickly say to you, Ashley, is that in the western part of the state, there is a youth subcommittee that is working to try to answer that question and come up with a youth plan that is sort of in line with the benchmarks and the criteria that was just described by Joe, which would include not just the youth that we have that are currently eligible, but also reaching out to other systems to identify youth and engage partners, stakeholders, funding, etc. So if you want any more information about the youth subcommittee in your region, I can get that information to you.
Thanks, Ashley. Thanks, Lee.
Thank you.
Anybody else?
Hello, can you hear me?
Yes.
Hi. My name is Emma Ward Williams. I'm calling from PA 504, Montgomery County. And similar to Beaver County, I just want to share some soft numbers that we have for our unsheltered count and our shelter count. So it's a long process. Everyone's pretty much familiar with that. But for the unsheltered count, we usually have about 6 to 7 known locations that we count, and this year we did 6. We have a very robust team of volunteers in process, so we had about 40-something volunteers that participated in counting these 6 different locations, and this year we did preliminary find 19 persons. We found 20 persons last year, but this year something different that we did with our unsheltered count as well. We did our first youth count, and we did not find anyone with that, so we're looking into next year picking a better counting site. As far as for our sheltered count, one of the major changes that we had was one of our transitional housing programs converted to permanent supportive housing. So a lot of those people transferred out, so that reduced our numbers a little bit. But our soft number count right now is 270 persons. So that's just an idea where we are with how many people we counted for our unsheltered and shelter pit counts.
Thank you.
Hi, this is Shannon from Lackawanna County. Can you hear me?
Yeah.
Okay, great. I have some preliminary numbers as well. Our numbers actually went down significantly for the overall count by at least 10%. They went down. Our emergency shelters for families weren't as full as last year, and there was a loss of a transitional housing program that led to lower numbers in that area. And I think some smaller family numbers contributed to the lower transitional housing count. And our total unsheltered did go up. It went from 11 to 14. I'm not sure the reason for that. I know it was mild weather, but I'm not sure the other reason. We did make a special effort to count youth this year. We had some youth focus groups, and we had a Come and Be Counted event, and we didn't count any additional youth from our special outreach efforts. So I think some momentum was gained in working with youth, and there's certainly more work to be done in ties with the schools in particular. So we're not going to just give up on that count, but for this year there weren't any additional youth counted.
Thank you. Anyone else? This has been very helpful. Thank you. Okay, we have a couple minutes left. I'm going to quickly do the Housing Alliance and Joe, and actually a little over 100 people are going to participate next week in regional meetings around the state with Senator Toomey's district offices, as well as the 3 new members of Congress and certain Republican members. And I just wanted to, and we are also going to Washington, D.C. on March 2nd. I think part of all of these conversations, the issue of resources is really important. So we are advocating again with the federal legislators around making sure there's a full funding for HUD programs, which you all partake in. So if anyone on the call hasn't joined a meeting and would like to reach out to me at joyce@housingalliancepa.org, or you can call our office. But I just wanted to let folks know. I think there are 18 meetings total scheduled in district, and then we go to Washington, D.C. on March 2nd. So if anyone would like to participate, please reach out to us. Joe, is there anything I'm missing?
The only thing else I would add is that if you're not able to join us, we highly recommend that you reach out to your local congressional member, your House, and as well as the 2 U.S. senators. Either try to get your own meetings or write letters and use their websites. They have web forms where you can just go to their website, type in your concerns and what you urge them to do. If you're concerned about McKinney-Vento funding or runaway and youth homeless funding, or your region's going to be losing vouchers, things like that. Be very specific. Just ask them, put that in there. The key thing is that we get a lot of volume about homelessness into the offices. So that they're alerted, they're going to be making a decision in April about how to continue with the federal budget. So it's critical that we get our messages into them between now and then on that. Joyce?
Yep. Thanks, Joe. Anybody else have anything they want to add? Again, do *7 to unmute. And thank you, everyone, for getting on. I appreciate it. Have a good rest of the week, and thanks again.
Thanks, Joyce.
Thank you.
Thank you.
Thank